minds think alike. Great Minds Podcast. Great minds think alike. Great Minds Podcast. Great minds think alike. Great Minds Podcast. Great minds think alike. Let's rock. You're now tuned into the Great Minds Podcast. You're now tuned into the Great Minds Podcast.
All right, welcome to the Great Minds Podcast. This is Derrick.
This is Vaughn.
And we're here with Dr. Chris Pernell. How are you?
I'm good.
Pleasure to have you on. So a brief introduction with Dr. Chris. We'll get into a little bit more as we go through the episode. Public health physician. She has a great story. We're looking forward to, hearing what you have to say and some of your views on things going on in the world right now. So definitely appreciate having you on.
Good to be here.
Definitely. The first thing I wanted to ask you as well is, how did you get into the field? Like, little girls growing up, did you always want to be a doctor, or was it something that you kind of stumbled upon as time went? How did that come about?
I always wanted to be a doctor, right? I am that textbook kid. So I grew up in East Orange, New Jersey, young Black girl in East Orange, New Jersey, coming of age in the mid-70s and 80s. And I can tell you, just like a lot of little kids, I wanted to be a doctor alongside so many other things. I loved music. I loved singing. I loved dancing. I loved gymnastics. I thought I was going to be the next Mary Lou Retton. To my sister told me I'm too tall. She's like, you're already taller than Mary Lou Retton. You cannot be an Olympic gymnast.
Definitely.
I used to build balance beams in my backyard.
Right.
I used to reenact Fame in my backyard. I used to reenact Michael Jackson's Thriller, Star Wars, Luke Skywalker. So I was a very creative, precocious young kid, right? But about the 6th grade, I started to really focus on medicine. And one type of doctor in particular, I told my mom after being in a class presentation, we had a guest speaker. I said, I know what I'm going to be. I know what type of doctor I'm going to be. I'm going to be a brain surgeon. I'm going to be a neurosurgeon. And from that moment, I started reading anything and everything to do with brain surgery. I had Ben Carson's book, Gifted Hands. I had his book, Think Big. My mother bought me the book, I Dream a World, had Alexa Kennedy in it. She's in there with a photo with her hands in a pyramid. She's the first Black female neurosurgeon. So I went through the rest of my life post 6th grade thinking I was going to be a brain surgeon. Seen on the wall one day at UCLA in the fall of 2003, just having graduated from medical school, and I had an epiphany. It was a neuropath conference. I will never forget it. I was a general surgery intern, and I said, I don't want to be a neurosurgeon. And it's kind of like I looked over my shoulder to see if somebody heard me. I said it internally, but I was like, whoa, did somebody just hear that? Because when I tell you, I told that to everyone, if you tried to dissuade me, I was going to come hard at you, because I was sold on Black excellence. I was sold on, Black power. And this was my way of living out my Black excellence and power. I was going to be the next great Black neurosurgeon. And so that epiphany on that wall, I started to realize that I was maturing into a woman who loved people, who loved community, who loved faith, who loved politics, who loved policy. And so from that moment, I started to back myself out of a surgical training career. And I wasn't sure exactly what still I would do, whether it be a neuroradiologist or some other type of neurologist. But ultimately, around 2009, I said, I want to do public health. And voila, got me here.
So how do you, you grew up in East Orange. I grew up in North. So I know, the familiarities with the towns and stuff like that. How do you stick to that dream? Because I feel like that's a common dream early on, whether it's like, I want to be an NBA, I want to be NFL or whatever. How were you able to be so persistent and stay on that path?
I'm going to give you 2 reasons. I was cultivated in the belief of Black excellence, and my household cultivated that, and my school cultivated that, right? My school in East Orange, I tell people my start in East Orange was the best thing for me, one of the best things that could have happened to me, because I grew up in a Black majority town, but still at a time where my school emphasized the sky was the limit, Black possibilities. And I learned all about key figures in Black history. My father, he in and of himself, a heroic man. We'll talk about this. I lost my father during this pandemic, but think about my father. He's a Black man coming of age in the Jim Crow South. He goes north like a lot of Blacks, escaping the racial terror of Jim Crow and lynching, looking for economic opportunity. He lands in New York with family and ultimately marries my mom and settles in New Jersey. But I saw my father, always a naturally intelligent man. I didn't see him do this part because I wasn't born, but he told me this part of the story. I saw him in the later parts. My father went from cutting grass at Bell Labs, the famous Bell Labs. The fact that we have three-way calling, the fact that we have caller ID, the fact that we have call waiting. My dad was associated with labs that came up with those discoveries. Wow. But he started cutting grass. So how do you grow up in a household with a man who starts out cutting grass, doesn't have a formal college degree, is self-taught, read textbooks at night, worked 2 jobs, and ascended the research throne to get a position that's normally reserved for masters and PhD scientists? That man raised me. That man. And my mother, loved me like I taught people. My mother had a PhD in love, loved me and affirmed me. So I really thought anything was possible. So that's how it stuck with me. My intimate family, and then my broader school and church family, I would say.
Right. And that, you gonna say something, Derrick?
I was gonna say that that's exactly it. I mean, if you grew up in a different type of household and had those same dreams, but your parents weren't the way they were, like, it's very possible that you don't push through with that.
Very possible.
Right here.
Very possible.
Yeah.
And I'm the baby of my family. You have to know the dynamics of my family. I'm the baby, right? So I don't mind telling my age. I was born in 1975. But my closest sibling was almost 10 years older than me. My big brother, Bishop. He raised me like his little brother, and what so forth. So I was very much the focus of my parents at that point. Yeah, right. And my parents were older, so there was some stability around that. But it wasn't to say my household wasn't challenged. We went through some stuff at times, but that's really why I got set off on such a strong start. It's my household. I know it without a shadow of a doubt.
Yeah, definitely, because you always need that sense of I'm not gonna say barrier in your back, but someone that always believes in you. That you can think anything I can do is possible. And a lot of times it starts at the home. Right. If your mom and dad or siblings believe in that, then you believe in it as well. And I see that your college choices, these are top-notch colleges as well. Princeton. Yes. If I'm not mistaken, you were cum laude at Princeton.
Yeah, I was. I should have been higher. I just missed a few decimal points. Don't talk about it. It's a little bit of a sore spot.
Oh, no problem. Then Duke University of Medicine, right? And then the Master of Public Health. Question: are you with Duke? Are you a Duke fan? Or that's a big thing.
No. So I was a UNC fan.
That's him. So he was looking to go.
I don't follow sports like I used to, but I told you my brother raised me like his little brother, right? Yeah. So my brother, whether he was working another job, he would call me at night. My assignment was I had to watch Warner Wolf. I had to listen to the news and listen to the sports recap. I had to give him all the scores across mainly football and basketball. So I grew up on sports, but then I told you I love tennis. I told you I love Mary Lou Retton, but I also love tennis. I thought I could be Monica Seles, Jennifer Capriati, Will Becker. And so I grew up around sports, and I loved UNC. I didn't like Christian Laettner.
Yeah. I think nobody did.
I couldn't stand him, okay? So when I had a friend in college, we used to watch UNC together. Shout out to my good friend Joy. She's a physician in the Maryland area. She played ball for Princeton, so I used to go to all her games, was supporting her. And so I went into Duke like, look, I'm not a Duke fan. And you gotta imagine, it was like crazy, like pandemonium. I did camp out for tickets because you can't deny that experience. Right. So I camped out, right? Me and my friends, medical students, we camped out, slept in the back of a U-Haul truck, rose overnight, and I got tickets, and I saw Duke play NC State. Never forget.
Okay. You know what's crazy about Duke? I actually I didn't go to Duke, but I visited Duke. I had a former VP, and throughout my hiring process, he received his master's from Duke, and he knew that I liked UNC. I don't know how he found it out, but I'm like, he goes, all right, Vaughn, we're gonna go. We went on a trip to Triangle Park.
Right.
In the medical, we know how that goes. So at Triangle Park, and then he's like, all right, come with me. I'm like, where are we going? Don't worry about it. So he takes me down to Duke. I'm like, don't take me to Duke. I don't want to go to Duke. Take me to Chapel Hill. So he's like, no. We're gonna go eat. We're gonna go down to Duke. So we went to Duke. Beautiful campus. Great campus is beautiful.
Modeled after Princeton. It was built to look like Princeton.
You know what? I thought that when I looked at it, right? So we go in there.
I made that mistake and said that on my Princeton tour. I say, hey, you all look like Duke, because I visited Duke first when I was visiting colleges, and they looked at me like, how dare you?
No, you haven't mixed up, right?
It was modeled after Princeton. I was like, sorry.
He actually took me down to to Cameron. And we went to Cameron and we walked in. There was nobody there, just us. I'm like, are you serious? We sat down on the bleachers. I'm like, this is really tight. That's the first thing I said. I'm like, I can see why it's intimidating. Yeah, it's like they're right on you. Yeah, and we sat there for a while. Yeah, so I thought that was his little jab to me. He's like, I'm gonna take a UNC fan to Duke's campus, but it's a great campus.
Rivalry is real.
Oh yeah, I tell them all the time up here. It's real. It's not a joke. It's not a joke. But it's more real with the fans than the players.
Yes.
Right?
Yes.
Yeah, the players, like, they hang out. They might see each other, they talk, but the fans take it to heart.
Definitely.
Just to get on it off on a tangent, like, we see it on TV and we see the people jumping, the people had their shirts off and got the chest painted. What is the energy like when you're actually in the building?
It's unbelievable. You can't hear. You can't hear. We had pretty decent seats. I actually ended up going to 2 games because one of my friends knew one of the ball players.
Okay.
And so, because she had gone to Duke undergrad, and she knew one of the ball players who were still on the team, because this was like, she went directly undergrad for Duke into medical school.
Okay.
So I saw another game too, and one time we walked in right after the team. It's like,
right there.
Like, who are they? So it's really, the energy is through the roof. You're caught up in the myth and folklore of it, right? Hands down, quality basketball dynasty, right? Hands down.
Yeah,
Coach K, hands down. I was a medical student when his daughter was delivering a baby.
Wow.
So it's just to know that you were in that atmosphere, you got to appreciate it. So it's something I'll never forget. And I'm glad I camped out. I'm glad I camped out for tickets. It's an experience. I'll be able to always say I camped out for tickets. And I even gave one of my tickets to a family member, and he came down just for a game.
Oh yeah, definitely. You have to.
Yeah.
So Dr. Chris, all right, I want to talk COVID impact in general.
Yes.
I know you say your dad passed away from it. Rest in peace to your dad. So as a physician, what was that like for you? Again, I'm a school administrator, so we kind of went into it thinking it was just going to be like a 2-week off thing. Mm-hmm. I remember going to see our basketball team in the state playoff game. This was like March 9th. Everyone knows, like, I guess March 12th or 13th.
March 13th, it was over.
Yeah, everything got shut down. And, I'm in a gym full of people during that day. I'm sure somebody, had that. I remember I was listening to Joe Rogan on the ride home. I had like an hour ride home, and the doctor that he had on, I don't remember his name, he was kind of just saying like how crazy it's about to get, and things like that. So for you, what were when the COVID first hit, what was your first thought about it prior to people getting really sick?
Right. So let me do a little bit of a year in review. So the first laboratory confirmed diagnosis of COVID was January 20th, 2020, right? Mm-hmm. So we are just a year out from this novel infectious agent ripping through the globe in pandemonium ensuing, upheaval ensuing, almost 450,000 American lives lost, 26 million plus cases, not to include the global impact. So when we first started to hear about this, I work in a hospital. When we first started to hear about this, we had our antennas up, because around December or so, there was information starting to be pieced together a little bit. There may be this unknown flu-like viral illness in China. January is when our antennas went way up. because you started to get confirmed cases. You got a confirmed case abroad, and then we got the confirmed case in the US. So we actually were on guard. There were patients at one time that had been on a cruise ship, and they came to our hospital. They had to be evaluated. They didn't have it, right? So we had to be in a state of readiness. Okay, so we spend January in a state of readiness if one case ever comes. We spend February in an even more heightened state of readiness. So we're having daily huddles. We're doing planning, contingency plans, lots of emergency planning, emergency preparedness, I should say. So at first in the fall, winter, when I first started to hear about it, I was like, is this another flu season? Will this be like another flu season? I remember having this conversation standing out in front of a CVS in Montclair with someone. And then by January, I noticed that, things are starting to kick off on the West Coast, in the Pacific Northwest, in the state of Washington.
Outside of Seattle, I think.
Yeah. And that's when I said, no, this is something different. Look at what happened in China. Look now what's happening in Washington. And like I said, we were in that state of readiness. We started to formally plan for whenever we would get our first patient before we got our first patient. So I went from what is this to a heightened state of readiness to March, literally just exponentially things increasing, getting our first patient, and then on that, a ripple effect. So if you talk about right just prior to the lockdown, to that 1 month, my dad is dead after a month off of the lockdown. And so I go from seeing, news reports to a hospital filled to the brim with coronavirus patients. I go to seeing news reports about it to having one of my last visits with my dad. We knew coronavirus was out there. My dad was at another hospital, not the hospital where I work. He was there for something non-related to coronavirus. My dad had been in rehab. He was, getting himself back on his physical and clinical baseline so he could come home. My dad had survived end-stage lymphoma, had very aggressive COPD. My father had HIV/AIDS. Like, my dad was like the bionic man. He had survived everything, right? Mm-hmm. So he was living out his home stretch on his own terms. In rehab, gets an infection in a catheter that he was receiving some antibiotics through. So I was like, send him to the hospital. We got to work him up to make sure he doesn't get septic. My dad is there maybe 10 days. And one of the last times I saw my dad, I didn't want to go all the way in his room. I said, look, Daddy, things are really picking up at the hospital. I don't want to bring anything to you, right? So I would visit him and I would stand in the doorway. And there was a bed at the doorway, and then my dad was in the other bed, and there was a chair in between. And so I was trying not to go all the way up close to him. One time he staggered a little bit because he was unsteady, and I had to catch him. And I was even concerned. I remember telling my brother, I hope I didn't, bring anything to his room. Then probably within the next week after that visit, my dad suddenly had symptoms. I remember his doctors called me. My father's vitals were dropping. He couldn't breathe. They're like, we're going to have to rush him to the ICU. We're not sure what's going on. And I'm like, do whatever you have to do to stabilize him. My dad has about 3 episodes like that. And then the doctor says, I'm going to have to test your father for coronavirus. And I'm like, oh, wow. And you should know, my dad gets tested for coronavirus. He gets a positive coronavirus result, because at this point, the hospital is shut down. One of the last times I saw him was when I stood in the doorway, right? And I caught him. Hospitals are on lockdown. I can no longer go in. I can only talk by phone when he's having these episodes. And when the doctor says we're going to have to test them, and they give me the phone call, and he tells me, look, I have it. I'm trying to pump up his spirits. I'm like, look, you're going to beat this. You beat everything. We're going to get you back to your baseline. Just hold on, Daddy. Hold on. Not long after that, I get symptoms and I get tested for coronavirus, but I didn't have it. My test was negative, although I felt like I had it. I'm still, I was suspicious for a while, but I didn't have any antibodies. And so literally in a space of a month, I went from seeing coronavirus patients in my hospital. I don't do direct patient care. I'm in leadership, but I do population-based care. So I go from seeing patients in my hospital to my father being diagnosed to my father being dead.
Wow.
That's how it happened, that fast. And the last thing I would say, and I've said this so many times, and I want people to understand what this is like, the weekend before my dad died, I had called back and forth to the care team trying to get information. It was like a fog of war. You couldn't get through always to the clinical teams because they were just so hectic. They had so many patients. No one knew exactly how to treat this thing. We're better at treating it. We don't have one defined therapy. We're better. But back then, we were grasping for the best evidence.
Trying to figure everything out.
Every day, just trying to piece it all together. And so I was always calling, whether I was at work, and then that weekend, I was like, look, I need to hear something about my dad. It was hard to get through. People were trying to help me. He had to get a blood transfusion on Sunday. I saw on social media, and I think it was Facebook, another friend and colleague who's a physician, a Black woman, wrote a status that her father just died in another hospital from coronavirus. And it stunned me. I said, I need to call the hospital and check on my dad again. I called, and the nurse said to me, he doesn't look good. I'm like, what do you mean? He was holding steady. He hadn't been eating a lot, but he was just holding steady. He was getting a blood transfusion. And she said, used a clinical term, and I knew my dad was not going to survive. Wow. So I started to prepare my family. And the next day, which was a Monday, we had gotten a phone call Sunday night. The doctor said definitively he's not going to survive long. And that next day, I go into work just because I'm trying to stabilize my teams. This is why I want people to understand. I'm so concerned still about work because we're in the midst of a pandemic. We are the epicenter of the pandemic. So I want to make sure my teams get the appropriate supports that we can do what we need to do by the patients. I race into work. And then I called the nurse and I said, look, can I get special permission? I had asked the night before. They didn't allow me. They allowed my brother to go up because he's a bishop. I said, he just wants to pray with him. We knew he was passing. My brother went up. He prayed with him. I said, please, can I come? And they're like, no, we just can't. We can't do it. So that next day I called again and I said, look, I just said, I'm going to ask again. He's my dad. And so I said, can I please come? And they were like, come now. I raced to that hospital. My father's hospital is 4 miles from my hospital. When I got to the hospital, literally, I turned off the ignition of my car. I got the phone call. He died. Oh, that's what I want people to understand. When we say we were living in the epicenter, it was like war. Yeah. When I tell people that the epicenter not only landed in Newark, or not only landed in New Jersey and New York, and it landed on me personally, that's what I'm talking about. Not only losing my dad, ultimately the week of my father's funeral services, we had like a virtual funeral, only 3 or 4 of us going to the funeral home. And then we buried him in Virginia, but we couldn't travel with his body. So we watched them bury my dad through a virtual service. Oh in that week, my sister tests positive for coronavirus. So then I have a father who I've lost in the pandemic, and I have a sister who's what we call a long hauler. It took my sister 9 to 10 months to approximate her baseline. She's not yet back at work. Hopeful soon to get her back in work, but she was once on supplemental oxygen. So when I tell people that the epicenter of this thing landed on me, that's what I'm talking about. So I don't only speak from a scientific place, being a public health physician and a health equity doc, but I speak from a personal place of having experienced it. And by now, the death toll, unfortunately, has gone up in my family. I've lost 2 cousins, one who was a Newark postal worker, Thomas Franklin Boswell Jr., and my other cousin, William Boswell Jr. So this has impacted my life like it has impacted so many Black and brown lives.
Right. Wow, God bless them. So do you think, and hearing your story, it's kind of weird that it seems like people, because when I first heard about everything happening, being up north, I think we took it serious, meaning that once we heard it and within my immediate family, I'm like, okay, all right, I don't know what's going on, but I'm watching CNN every day. I'm watching everything, what's happening. I'm seeing it. My wife's like, turn that off. I'm like, no, I need to know what's going on. Right. So my mom and my family have moved to North Carolina. So they're down in North Carolina right now as we speak, and with my grandmother. And I'm like, Mom, are you guys tuning into this stuff? She's like, yeah, but no one's taking it as serious down here. I'm like, what do you mean? She's like, people aren't wearing masks either. I'm like, but she was wearing a mask. She's like, when I go out with a mask, people look at me like I'm an alien. And I'm like, that's a problem. That's a problem. I'm like, Ma, I don't care what they look at you. Keep your mask on. Wear it. And my mom is, I call her hypochondriac. She's afraid of everything, right? She's like, I'm not going to the store. I'm buying this. I'm buying that. I'm like, all right, just be safe. So do you think, like, I've come to find that as a whole, not us on this pod, I don't think people are smart. And when I say that, people, I'm not trying to be harsh, but I don't need to have something happen to me directly to know the seriousness of it. So I can live through other people's stories and go, okay, this happened to you or this happened to XYZ. Let me be careful. It seems like people aren't wired that way. Do you think it's something that the way we're brought up, or is it like a lack of leadership? During that time, we didn't really have that. So do you think that all plays a part in people's thought process?
You know, I think the most salient thing that you just mentioned was a lack of leadership. Okay. Because think about, people don't necessarily, so I'm a public health physician, and so I see the flu differently than other people see the flu. I'm like, make sure you get the flu shot. You know how many people lose their lives to the flu every year, and people are like, it's just the flu, right? And so people tend to not be as accessible to an illness unless they can see the widespread devastation of it and or the up close devastation of it. But what was unique about this pandemic was the abysmal failure in leadership.
Yep.
You had at the levels, highest levels of federal government, a president downplaying the pandemic, a president trivializing the pandemic, saying, "Oh, maybe you could do a mixture of Lysol and bleach and you'll, cure yourself."
Right.
I never in my lifetime would I have said to you, "Oh yes, a president of the United States would not understand the severity or just the sense of urgency of this crisis." And I think that definitely impacted people's ability to grapple with the pandemic, right? Because that led to an uneven response. So you would have one state, right? So New Jersey, case in point, you would have one state that was hyper focused on the pandemic. Okay, we need to do shutdowns to control the spread, to flatten the curve. And then you'd have another state where the governor was like, "Oh, you don't need to wear a mask. Oh, go about your business." So people got conflicting messages, right? And I think that allowed people to rest in their own understanding of the pandemic. And that was really unfortunate because that contributed to additional loss of lives.
Definitely.
Without a doubt, that made this crisis even more devastating. And the part that, really, really sat with me and sat in my heart was, yes, this pandemic tore through the globe and devastated almost all lives that came in contact with it, either devastated economically, socially, or it devastated it clinically and physically. But Black and brown people shouldered this burden
Definitely.
in a way that was so destructive to our community. So if I tell you that, Indigenous and Black Americans, their mortality rate of COVID exceeds 1 in 750, Latinos being around 1 in 1,000, we're dying at sometimes two times higher rates than white persons. We're definitely hospitalized at 3 to 5 times higher rates. Our case infection rates are anywhere from 1.5 to 2 times higher. And now we're getting vaccinated at disproportionately lower rates. So that in and of itself, the fact that the pandemic heightened or made us more aware of inequities is what made the lack of leadership at the top level even more dismal, because
that's a good way to put it.
That compounded everything that the most vulnerable, marginalized groups experienced.
Right.
I wanted to add one thing real quick, Derrick. So I'm not going to say any names, but I went somewhere, and since the pandemic has happened, pretty much I go where I need to go, and not too many different places. And I'm more concerned about other people, right? So when I put a mask on, when I watch where I'm going, it's basically to protect other people, because I feel great, but it's asymptomatic people out there. We all know that. That's the biggest problem.
Right.
So a week ago, I had a friend that was having something going on. I'm like, I don't know if I want to go. I'm like, I'm good. My wife's like, you gonna go? I'm like, I don't think it's supposed to be a dinner, right? So I thought, okay, where we're gonna have this dinner. I won't say the names of any places, any people. So I'm like, okay, look, I'm going to buy something for this person. I'm going to bring it through, and I'm coming home. So my wife was like, oh, yeah, okay. We'll see. I'm like, I promise you, I'm not staying long. So I get there to the event, and it was a whip to get in, but it was spacious in the place. I'm like, all right, whatever. I have my mask on. Then they go, oh, no, the party's in the back. I'm like, all right, go to the back. I'm like, okay. So I go to the back. I hit the corner. there's people around no mask who could smoke. I said, listen, okay, my mask is on. This is your thing. I left my house at 10:05. I was back in the door at 10:25.
Gonzalez, right?
Gonzalez.
You were like,
I was like, because like at first I thought, let me see, I might stay for 5 minutes. Once I saw the atmosphere, I'm like, why don't people get it?
Yeah.
I'm like, it's like a petri dish. It's like sitting right there. I don't get it.
Yeah.
So that kind of made me just rethink. Not saying how bright people are, but what aren't they getting? You know what I'm saying? I think.
Yeah, I really think one, people are fatigued at this point, right?
Yeah.
Oh yeah, that's what
So they're just tired. They're like, okay, hands up, I give up.
Enough.
I'm tired. I'm tired.
Tapping out.
Tap me out, right? And it's hard to maintain that level of vigilance that is necessary to protect and save lives. But that's why I talk about my experience. I talk about my family. I talk about what our community is experiencing, because this is how I say it, whether I say it to my church, shout out Behashem Yahweh and Yah Squad, whomever I'm saying it to, I'm like, don't take unnecessary risk, right? Because of what you said. You might be an asymptomatic carrier, but you might come across someone else who can't fight it.
Yeah, somebody's grandmother or.
Right. Either they might lose their life like my dad did, or they might be a long hauler like my sister. Her life was dramatically changed. Okay. When I tell you it took her 10 months to get back to her baseline and she had to use supplemental oxygen for a while, her life was dramatically changed. And so, we have to find a way to shock people out of their complacency, so that we can get to the point that we can live more open lives, because we are not there yet. We're not there yet. And I think I see people relaxing up, we're not.
Oh yeah, definitely so. I know you took the vaccine. I know you did the trial for obvious reasons. You were impacted directly with your sister and cousins and your dad. What do you say to people that are hesitant? And especially Black or brown people. Like, I look at the stats and like, we're just not doing it. And and part of it, and I'm going to be transparent, I think part of it is like just lack of trust of this leadership thing that
right. Thank you for saying it.
Spoke about earlier. And I'm going to be transparent. I'm part of that. I need to kind of like see.
You're the wait and see.
And now,
right?
Now I go to work.
Good. Let's talk about that.
I go to work. I mask up at work. I mask up. I haven't had family over, and I'm fatigued too. But I'm like, I'm pushing along because I know, and I've seen the impact. And you tell your stories, and I hear other stories. And I always joke. I'm like, all right, well, because we're watching science in real time, right?
Real time.
I was having a conversation with a friend.
It's like nothing we've never seen before. I'm telling you.
Yeah.
We're in a very peculiar and unique time. And I love that you described it the way you described it, because that is what we're encountering in community, right? So let me tell you what I tell people, whether I'm talking at the NIH or whether I'm talking to a faith-based group or whether I'm talking to people who call me or text me on the phone. We have to validate people's fears, people's skepticism, and people's concern, because it's not unique to you. We see it in the healthcare environment too.
Right.
Okay. Not all healthcare professionals were very eager to get vaccinated. Okay. Yeah. And so what we know, especially in the Black community, in the Black and brown community, but especially in the Black community, there is a trauma that we've experienced collectively. I tell people we've experienced a collision of two pandemics. The fast pandemic was the novel coronavirus, right? That upsized the world, capsized the world, I should say. And then the second pandemic was a slow pandemic named systemic racism. That's been with us for 400 years in the soil of this nation. The collision course of those two pandemics made the devastation in Black and brown communities worse, but it also makes the skepticism heightened, right? So if I say the names of the enslaved Black women who were tortured with gynecological procedures without the use of anesthesia because they weren't seen as humans but as chattel, I can say the names of the Black men, the nearly 600 men who were abused through the Tuskegee syphilis study. I could say the names of Henrietta Lacks, the Black woman in Baltimore who had tissue taken from her cervical womb, which has gone on to produce countless discoveries because it's what we call an immortal cell line. And I could say the name of the present day Dr. Susan Moore, Black woman physician in Indiana, who fought for her life, opened up her phone, put her story on social media and said, racism is killing me. They don't believe me. They don't believe my pain. They won't give me the chest x-ray or the chest CT. They won't give me the medication to treat me. I know what I'm talking about. It's historical injustices juxtaposed with present day disparities that teaches historically excluded communities not to trust the healthcare system.
Yeah, and I don't even have the type of knowledge or the type of stories that you had.
But it's in your psyche. It's there.
But, yeah,
It's
subconsciously, that's just kind of it. It kind of what it is. I joke. I'm like, and I talk to some people about work about it. I'm like, I'm a Black man in America. As far as I know, they have a vaccine for Blacks and a vaccine for other people. I don't know.
No, this is what I tell people. I've had conversations, like I said, from the academics to the folks in the hood, right? And we have to say, I get it. I understand you, and I validate your concern. And always what I tell people, I'm not here to convince you. What I want to make sure of, though, is that you have all the accurate facts.
Yep.
I want to make sure you understand the science. I want to make sure that you understand the race benefit ratio, right? So when I talk to Black people, I say, look, you are at you as a Black person in the United States, you are at higher risk of exposure because of where you work and where you live and your access to care. You are at higher risk of hospitalization. You are at higher risk of death. Now, if you weigh those risks against the risk of an adverse reaction, the risk of exposure, hospitalization, and death dwarf the risk associated with an adverse reaction. The CDC looked at the data from the first early days of when just Pfizer was available, right? And if you convert the ratio for every 1 million doses that are administered, there were 11 cases of anaphylaxis. That's the most serious adverse reaction that you can get. So that's rare, 11 out of every 1 million, right? And no one died from anaphylaxis, meaning anaphylaxis is a closing in of your throat, it's swelling, you feel like you can't breathe. That is treated with epinephrine. Some people have to go to the hospital and have to be observed there, but then they recover. And so I just want to make sure people are not taking unnecessary risks. And then two, I want to make sure people understand, yes, these vaccines were produced in a very hyper-partisan atmosphere, but the science didn't cut corners. Not the science. The politics at times were unethical, but not the science. Exactly. And where I make the difference is that, for instance, we're living in a game-changing time. Messenger RNA technology is going to change clinical medicine. Is going to change it. Messenger RNA technology did not just happen. And I think that's another thing from people's perspective, we literally discovered this overnight, but we didn't, right? And so we didn't. Messenger RNA technology has been known about for decades. And whether we're talking about, we never brought a vaccine to market, meaning we in the scientific community, whether it's through cancer vaccines or what we learned just about coronaviruses is a family of viruses through Ebola, MERS, or SARS, it was the perfect timing. It was an accumulation of science around the mRNA vaccine technology, plus discovery around coronaviruses as a family. So we knew what to target. We knew to go after that spike protein. We knew what state the protein needed to be in. So we could design, again, being the scientific community, could design a vaccine that was specific to what we needed to target. And it was genetic instructions and codes because we understood messenger RNA. And I don't think most people know that we had the science around for decades. I don't think most people know that the federal government's involvement outside of the hyper-partisan climate was probably the most effective example of the federal government helping to produce a public good, meaning that the federal government infused capital, dollars into the process so that pharmaceutical companies would study the product itself, whether it's safe and effective, at the same time that they studied manufacturing, meaning how can I manufacture millions and millions and millions of doses in a short time period? Usually that happens in a sequential fashion. That's why it takes 7 to 10 years. The quickest vaccine to market before was mumps, and that was 4 years. This technology is different. And I want to make sure Black people understand that. I also want to make, the last thing I'll say, I want to make sure that Black people understand that we were at the forefront of this discovery.
Really? I didn't
We
know
weren't
that.
only, right, real talk, we weren't only devastated by this thing, but we were at the forefront of this discovery. A young Black woman, a young Black sister, Kiznikia Corbett, Dr. Kizzy, was on the team at the NIH that designed the messenger RNA vaccine with Moderna. I need my people to know that.
Yeah, we gotta put some respect on her name.
Definitely.
No, Black excellence is saving the country yet again.
Yeah.
And I need people to be able to digest that. And I think as people, see people like myself, so I've been fully vaccinated, and I've been fully vaccinated, longer than most Americans because I was a part of the trial. I got my first dose August 31st. I got my second dose October 2nd. So I'm good. December, January, February, 3 months. And I don't have any long-term or lingering impacts from the vaccine. So the wait and see crowd, there's a decent amount in Black people. If you look at polls, Black people are different from people in the rural areas and Republicans who say never. A higher percentage of those who live in rural neighborhoods or who are Republicans say, I will never get the vaccine than Blacks. There is a portion of the Black community that says, I need to wait and see. That's so our culture, right?
Yeah, right? I'm in it too. Yeah.
Right? If so many things have historically or present day have gone wrong, you're like, let me wait and see. But what I want people to know is waiting and see could be deadly. It could be costly in this permanent environment.
Definitely.
I always joke. I'm like, I want to know if, I grow an extra pinky in a year. Let me
Right. We
first.
don't have people coming up on a year because from the early phase trials started about March 2020. Right, for both pharmaceutical companies that produce messenger RNA vaccines. So by this March, we're going to be like at a year of those people. Late phase trials were later around July, August, like when I got involved. So we have some data to know what it's like a year out. I'm going to be followed for 2 years. And this last fact that I'll give people, if you're going to develop an immune-mediated adverse reaction to a vaccine, it's most likely to happen in the first 6 weeks. That's why the FDA mandated 2 months of safety data. So if an immune-mediated adverse reaction is going to occur, it's going to occur in those 6 weeks. It'd be unbelievably rare that it would occur outside of that.
Gotcha. Yeah, I think it's most of people's ignorance to the vaccine in general, not knowing enough about it. And also when people think about medicine, we know if we would think if you're able to come out with a vaccine for COVID, you've been working on it for a while, there's other diseases that's out there, right? So people go, well, what's going on with a cancer one? Like people start asking questions about that. And that's why people, I think, look at it differently. And I always was under the assumption, just with medicine in general, how typically medicine works to me, is that I think there are cures for certain things. I could be wrong, but this is me thinking, all of me. Right. That there are cures for certain things that's out there, but the money's in the medicine, right? So I usually think to keep you alive. Like, all right, so if you can cure something, right, it costs whatever it costs, say $1,000, whatever it is. But if I keep you on this drug for 20 years of your life,
you get 20,000.
I
get, that's the thought process. And I'm not saying anybody's name, but people.
No, I hear you because I hear. So I've done, as you can imagine, I did an Instagram live with Dame Dash, right? Okay. So on this very topic, right? But Dame Dash is the perfect person to do Instagram live with on this topic, and he won't mind me sharing this. Dame Dash is a type 1 diabetic. So Dame Dash lives by medicine. Dame Dash lives by technological advances in medicine, right? So the glucose monitoring, that happens in real time, and infusion pumps that keep type 1 diabetics alive. That's how he is alive. So when people are like, oh, I don't know if I can trust this because, I don't know what's in the ingredients. And he has a good way of explaining it. He was like, I can tell you this. I never have questioned what's in the ingredients when I'm fighting for my life or when I was in pain. I didn't want to know what's in the ingredients. I want to know, is it going to work? Is it going to keep me alive, right? And so he's giving people a different lens to think about. But what you said, I want to focus it and connect it back to something I said. I said this was one of the best examples of smart government involvement to produce a public good. I want people to pay attention to the fact that when the government got involved in an effective, efficient way, we were able to arrive at an answer. True, the science was ripe. True, both what we knew about mRNA vaccine science in general, as well as science around coronaviruses were ripe, but also critically, the federal government got involved. And so what I hope to see happen, it's not going to happen in every condition, but what I hope to see happen is the coalescing of funds, the coalescing of resources, and the coalescing of focus on other illnesses and other conditions that plague vulnerable and marginalized groups, right? So if we could get together to solve for X and arrive at a coronavirus vaccine, can we get together and solve for the pharmacy and food deserts that are in Black and brown neighborhoods? Right. Can we get together, and solve for a cure for sickle cell? A disease that plagues and devastates primarily Black persons. And so I say that to say, yeah, keep that antenna up, keep that lens up, and let's focus that to drive justice into the process. Health justice is a focus of mine. So let's drive justice into the clinical research process because, hey, we got some other problems we can solve if we all get together and we're in hot pursuit of an answer.
That's a fact.
Definitely. Wow.
I want to transition this to something a little bit lighter, right?
Mm-hmm.
What do you do in your free time? Like what TV shows you watch, the music?
Okay, excellent question. Well, I'm a news junkie. I'm going to tell you, I've been a news junkie. I'm a proud nerd, but I'm cool. I'm a cool nerd.
Being a nerd is cool now.
Yeah, I know. It's so cool, right? It's so cool.
It should have always been cool.
Yeah.
I always was.
Yeah, exactly.
So I've always liked the news because my dad raised us on the news. I used to participate in news bees and contests and things like that. So I always watch the news. I usually have, CNN or something else on. But in addition to that, I love music. So I grew up in a very musical house. I recently wrote a piece for MSNBC and I started it talking about, last week would have been the 90th birthday of Sam Cooke. I grew up in a house where I heard the music of Sam Cooke, Patsy Cline, Kenny Rogers, Willie Nelson, Michael Jackson, Whitney Houston, Nat King Cole, the Temptations, the Four Tops, you name it. My father loved music. So my father always played, I didn't have the nicest furniture in my house in East Orange, but I had the best sound equipment of anybody. You would think my dad was we had speakers up to the middle of the wall. And we grew up listening to music, right? And I just named a very eclectic list of Patsy Cline, from Patsy Cline to Sam Cooke.
Right.
Yes.
To Bing Crosby. I heard it all in my house. So, and both my father and my mother grew up in very musical families. Both my father and my mother were a part of traveling gospel groups, traveling family gospel groups. There are three themes that run through my family. Faith is one, science is one, and love of family is another. And so both of my parents were preachers' kids. My father's father, very studious theologian, a bishop that planted hundreds of churches in the South. My mother's father grew up and was raised in a rural part of Virginia, was a Baptist minister, a staple of his community. But both of those kids grew up in households where their parents had them singing. And they used to travel. And I believe it was my mom's group integrated a couple of the radio stations in their neighborhood in their day. So I have always loved music. And so whether it's through my church, again, shout out to Yaswa, my church has a hip hop outfit that's doing some pretty radical stuff around hip hop. And so I've always gravitated to music. I danced when I was in college. My dad used to say, you didn't go to Princeton to be a rockette. But I was a part, and I led the Black Arts Company at Princeton. I was invited to audition for off-Broadway dance productions. So the arts has been a constant theme. And so I always tell people, I've had so many injuries at this point, and various surgeries, whether on my knee, injured my hip, and my toes. If I could do anything, I wish I could still dance like I used to. because I love dance. I used to love Broadway, and a very eclectic taste. I really love neo soul. I think that's my most favorite.
Okay. That's your lane.
I love hip hop as well. And so if it's not news, it's music, it's arts, and then it's faith. I have my church, but Hashem Yahweh. I'm very, very involved. We have virtual services now, one in person where we got plexiglass. We're all walled off to an assigned seat. But I love people, and that's what helped move me out of one type of medicine into a different type of medicine, public health, right? So, and if we weren't in a pandemic, I would be traveling. I love to travel. I was supposed to have been in Australia already, in New Zealand. I was supposed to have been in Brazil already. I was supposed to have gone to the Grand Canyon with my nieces. I love to travel. And so usually I will be planning out a trip every 4 months. And I'm really like, I'm my own personal travel advisor. Like, I don't hire anybody. I
do it yourself.
Yes, I enjoy doing the research. Like, we went to Egypt with some friends, stayed in this nice Airbnb home, had a private chef, had guards outside my door too, but had a private chef, was down in Luxor. I love travel. Yahweh's earth is beautiful, and to be able to see it, to breathe it in, those are the types of things that I love to do.
Wow.
Yeah.
That's great. So how about any movies or like any actors or anything?
All right. Okay. I just saw a good series on Netflix, Lupin.
Yeah, I heard that was good.
I'm thinking about that. Yeah, I seen it pop up.
You gotta watch it. You gotta watch
subtitles though, right?
Yes. Okay. So I'm okay with subtitles, right? But when I originally started it, I started last weekend. I was busy doing work for the hospital, and so I clicked it on behind me, and I didn't hit the subtitles. So I watched about 4.5 episodes with a voiceover. And at first the voiceover was hard for me I was like, why are people like rating the series? I can't take this. The voice is awkward to what they're mouthing. And then the action of it, it's very well written. I just got swept up into the storytelling. So I would definitely recommend that. I love that. I saw One Night in Miami.
Yes, that was good. That was really good.
I heard that was good. I gotta catch that.
I got a little bit of critique on that.
Which part?
Didn't quite do my man Sam Cooke justice. No, because you got to learn I don't think Black people realize what Sam Cooke meant to the Black Power movement.
And I definitely do. I know.
I do too.
Right?
I noticed it because they have the Who Killed Sam Cooke.
Right, the two killings of Sam Cooke. Also on Netflix. That should be required watching.
That covered a lot of it with the music ownership and everything like that.
I was just looking for a little bit more of that in One Night in Miami, but it was good. So those are some of the most recent things I saw. And then I love period pieces.
Okay.
So I'm into the whole Regency area, British aristocracy. I love Jane Eyre novels. So anything reinventing, adapting a Jane Eyre novel. I saw Bridgerton. That was all the rave that everybody saw, but I actually like Sanditon, which was different. And so I like that one better. But yeah, so I love film too. I love film.
I have a recommendation. If you have Showtime, watch Your Honor. It's a pretty good show.
Yeah.
Okay.
As
I'm on episode 4, so don't spoil it.
I'm not gonna say anything.
I haven't seen everything, but I love, like, we both like Bryan Cranston. I think Bryan Cranston is one of the best actors. Like, he can act in anything. Anything he wants is good.
He's good.
Yeah.
Hands down, he's good.
Yeah. But basically, I'll give you the premise of it. He's a judge, a highly ranked judge, and his son is involved of a hit and run. He plans on returning to men, but then he realized.
Whoa! You see a lot.
No. I'm not the same thing.
But as long as you only say what's in the trailer. Only the trailer, right?
He realized the hit and run was on a different type of person.
Okay.
And it gets sticky from there.
Yeah. I'm growing my taste around series, because I'm usually because I have a limited amount of time, I just want to watch it go.
Yeah.
But I'm starting to appreciate the series, and slow down, Chris. Watch, slow down a little bit.
Yeah, that's very good though.
Breathing in hell. So no, definitely I'll take that.
Because I think we live in a popcorn society. So we live in a Netflix society where they drop the 13 episodes right away. So you have to wait a week. You're like, are you serious? A week for this to come back on? Our brains aren't trained for that anymore,
Yes. Wow. Yes.
I've even been willing to just wait 3 months for the show to go off, just so I can watch it in a week.
Yeah, I have friends who do that too. They're like, no, I don't want to watch it while everyone else is watching it. I'm going to wait till it's done so
Right.
then I can see the episodes and control the rhythm and the cadence of it like I want. So yeah, I can appreciate.
See, that started back in the days of The Wire, back in like Wire episode 6. So what we used to talk about, Derrick and I, we used to we found out that you can watch the new episode early.
Yeah,
right?
it was like midnight the day before.
Midnight the day before. So we figured out, no, it was a full week.
Oh yeah, you're right. It was like
we used to see the episode so we used to watch it. So he used to watch. I'm like, I can wait. Like, there, you gotta wait. I want something to look forward to. Now I'm just like him. I can't wait no more. Like, I want to know right now if it's available. I'm watching it. I don't care.
Yes. So.
All right, so Dr. Chris, we end our show with what we call a rapid fire.
Okay.
Just a this or that. It could be an open-ended question. And we make it fun. So,
okay, cool.
Ready to go? All right. I know you say you like to travel. What's your favorite travel destination?
Oh, favorite travel destination. Can I give you some ties? Egypt and South Africa.
Okay, cool.
All right. So I'm going to take it to TV. You didn't mention TV, but I'm pretty sure this is old shows. Martin or Fresh Prince of Bel-Air? Which one?
Oh, I think it depends on the day of the week. First, I'm going to go with Martin because me and my cousin Corey, that's my heart, that's my homie. We cut up to Martin all the time. But you can't deny the Fresh Prince. So day of the week.
I think the Fresh Prince is a great show. It wasn't always comedy. It taught you something. You had Uncle Phil. It was a good lesson. Martin was straight. It sometimes had a little lesson, and then it was really comedy. Sometimes had a little one.
Martin didn't have any sense.
Exactly.
All right. If you had to pick a doctor that was most influential on you, what would you say?
Oh, most influential on me. I'm going to give you Dr. Alexa Kennedy, first Black female neurosurgeon.
Okay. Sounds about right.
Yeah, right. Mm-hmm. So I'm gonna go to movies. Who is your favorite actor or actress that whenever they're on, you have to see that movie, or you're gonna go to the movie theater when we can't go to the movie theaters again?
Okay. So I love Viola Davis.
Yes. She's the truth.
Okay. Much respect. And I like Denzel. I just watch little things.
I gotta catch it too.
Yeah, I gotta catch it too.
Yeah. So I'll go with those two.
All right.
Okay.
And Robert De Niro though is good too. I love Robert.
Oh yeah, Bobby D can do no wrong.
He's like a class in superb acting in every appearance. Right. So
absolutely.
Exactly.
All right, what's your favorite Michael Jackson album?
Oh.
It should only be two choices.
I think I have to say Thriller because I used to reenact it in the backyard every day. But Off the Wall comes a close second.
Yeah, I was gonna say those are the only two choices.
Yeah,
it's only two choices.
Those are the only two, right?
For the greatest ones. I mean, he's got a lot of great.
For greatest, hands down, down.
All right, you have a dinner party with 5 guests you can choose, past or present. Who would it be?
Malcolm X, Harriet Tubman, Fannie Lou Hamer. Gotta have my mom there.
Yep.
This dinner about to be popping.
Well, that's 4, right? I need 4. Shirley Chisholm.
Ooh. There we go. That's gonna be it's gonna be. Can I come? That's gonna be a fly on the wall. I'm gonna eat nothing.
Yeah, let me serve the food. Well, Dr. Chris, it was a pleasure to have you.
Yes, thank you very much.
Thank you.
I enjoyed it.
Shedding light on everything, and I mean my personal hesitancy on certain things. So I appreciate your thoughts on that, and just being transparent with your story, not only here, just like throughout the world and throughout the different networks that you're doing that. So that's greatly appreciated. I think we need to hear that as a community.
Thank you. Whatever Definitely. I can do to build with my community, amplify and uplift Black voices, sign me up.
Right. Sounds great.
You want to share any of your information, social media, website, or anything?
Sure. So definitely want people to tune in to Life Clinic with Dr. Chris. I just started a YouTube channel. This is how you're going to get nothing but the facts around coronavirus and in particular the COVID-19 vaccines. I'm on Instagram, The Good Doctor MD. Check me out. My Life Clinic page is also on Facebook, and on Twitter, I'm at Dr. Chris MD. You're going to get news as it pertains to public health, as it pertains to health and racial justice, as it pertains to arts. And so find me on any of those platforms. Oh, and look up the Yas Squad. Look up Yas Squad. That's my group.
Yas Squad, okay.
My sister-in-law, one of the dopest MCs around. Has flipped classes from this, like, Black Sheep to
this and that
to LL Cool J, Mama Said Knock You Out, which he retweeted, to Missy Elliott. She flipped her Super Duper Fly Rain, which she retweeted. So look for the app, Apostle Pastor Passion and Yas Squad.
All right. We check that out. Well, thank everybody for watching or listening. You can follow us on IG at The Great Minds Podcast, on Twitter at The Great Minds P1. Thank you again to Dr. Chris Pernell. We appreciate you.
Definitely.
Yeah.
Take care, everyone.
Great Minds Podcast. Great Minds Think Alike. Great Minds Podcast. Great Minds Think Alike. Great Minds Podcast. Great Minds Think Alike. Let's ride. You're now tuned into the Great Minds Podcast. 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 Derrick the Vaughn, old boy like Cam on a song. Culture safe now, thank God. The panic is gone. Time to heal from the pain. Take the bandages off. You gotta win. The stakes are high like a cannabis bomb. Okay, it's game time. Picture with the balls. That's a FaceTime. Great minds spreading faster than a rumor through the grapevine. Vaughn and Derrick deserve the merit. All salute. It's more than just a podcast. Show it's like a movie. Vaughn and Derrick, what up? Great minds think alike. It's the Great Minds Podcast. Great minds think alike. It's the Great Minds Podcast. Great minds think alike. It's the Great Minds Podcast. Great minds think alike. You're now tuned into the Great Minds Podcast. You're now tuned into the Great Minds Podcast. You're now tuned into the Great Minds Podcast. You're now tuned into the Great Minds Podcast.